Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. I'm going to get right to the show because I don't have any time to waste today. A lot on my plate. Been training doctors from around the country, a lot of things happening. So let's get right to business. So, first, today's show is by popular demand, a more um, complete show on Lyme disease. I call it Lyme disease, the great imposter pandemic, for a reason. Lyme disease has been around for thousands of years, actually. They found some of the what they call co-infections from that one little tick bite in blood found in mosquitoes in fossilized amber. So there's nothing new about Lyme disease except um, there's more and more co-infections that are coming from just this one little tick bite. You can get from one little tick bite, deer ticks they call them. I'm not going to get too technical on you. You can look them up. They have actually a very specific kind of tick that causes it, both here in the East Coast and in the West Coast. But Lyme disease is throughout the world. It's not just here. These ticks are so small. They're the size of of those little pink pencil, in pencils that have the little pink eraser on top. If you look at the circle portion of the top of the eraser, it's literally, I don't know, I mean, extremely small. Well, that's the size of a large adult deer tick. All right. Now, there's many, many, many different types of ticks. These don't burrow in. They just land on you. And when they land on you, they crawl around till they find skin somewhere, and then they bite. And through that one little bite, it feels to you like just a little itch that you want to scratch. They they deposit a number of different bacteria. Borrelia burgdorferi and minimoti. There's Babesia, Bartonella, Anaplasma, Ehrlichia, Rocky Mountain spotted fever. Now a new one called alpha gal. There's a whole bunch of different bacteria and spirochetes, a form of bacteria that are deposited. And when these get into your blood, they start to, duplicate. They can get into every organ and every tissue in your body. Now, sounds kind of horrible, but it's worse than horrible. Um, Lyme is a life-taking disease. It's not a life-changing disease. It's a life-taking disease. Um, it'll make you, while it's first growing in you and developing in you, and it can be for many, many, many years, while it's doing all that, it starts to cause various symptoms that we're going to discuss. That's what patients wanted me to talk about. So I'm going to, lengthen this original podcast that I did. But in any case, they go through different life cycles. And as they go through different life cycles, you get different reactions. Now, when you first get bit, you may or may not see a rash that looks like a bullseye. It's a red, pale red halo, then a clearer section, and then another redder section in the middle, just like a bullseye. So they call it a bullseye rash, but it doesn't have to appear. It usually does, but not always. Also, these ticks are so small and so light, they're airborne. So you don't have to be in the woods or in a forest or walking around where deer are. They can be blown into the air and land anywhere while you're outside. Now, what if they land on your head and they walk their ways down onto your scalp and they bite you there? You may scratch, wash it out with a shampoo that day and not even know that you had one. And you may get a bullseye rash on your scalp. You're not going to see it if you have hair. So you can't just live by, oh, I had the rash. Now, when you first get it, your immune system may or may not be strong enough to fight it to some degree. If it's not too, if it's strong enough, well, then you may feel like you get a little sniffle, like you caught a cold or something. It's not, you could get a feeling like you maybe caught the flu. It could be much worse, and you can get flu-like symptoms. In any case, it'll last for a period of few days to a few, to a week or so, and then seemingly be gone. Well, it's not. And in fact, as the infection moves around your body, these organisms can get into every tissue and every organ in your body and affect every system in your body. So when patients come in, sometimes they have they've been undiagnosed with it, and that's one of the problems with it, is that it's often misdiagnosed. It's diagnosed as almost anything else you can imagine, because it mimics many other diseases and conditions like rheumatoid arthritis and flus and aches and pains. And we're going to get into the symptoms in a minute, because that's how I help in the diagnosis of it. So why can't you just do a blood test and find out? Well, all the LLDs, the Lyme literate doctors, as they nickname themselves, call it, a positive test means you have it, but a negative test doesn't mean that you don't, because the testing is so poor. There is no great test that can definitely let you know you have it. Now, I don't do testing, I do treating. So the patients come into me after being sick for a while. But let me go on first before first with testing. So it's a blood test, and they can test you for Lyme titers. Not, excuse me, titers that you have been infected with it. And with that test, they come up with bands. Now, if you don't have 5 or more bands, then they can't treat you for Lyme. Why can't they treat you for it? Because insurance won't pay. Insurance wants to see definitive proof that you have something before they'll pay for it. So if you don't have certain bands, and 5 at the minimum, they're not going to get paid, so they can't treat you for it. In fact, let's say they gave you an antibiotic and there was an adverse reaction. They were treating you for Lyme, but they can't prove it, and you had an adverse reaction that harmed you, could even kill you from an antibiotic, then from an anaphylactic reaction. So they can get sued, and it's a serious issue. So they sometimes will hesitate until there is enough bands to prove you have it. Now, what's common is many people come to me and they've tested and they say, well, I only had 3 bands. And I tell them, well, I don't care if it's the Beatles, the Rolling Stones, or Tom Petty and the Heartbreakers. You're not supposed to have any bands at all. Why should you show bands for something, 1 or more, that of something you don't have? So bands don't mean very much. Now, there's only one lab, supposedly, from what everyone, all the my buddies tell me, my doctor friends tell me, a lab called IGeneX out in Palo Alto, California. And they seem to have a very specific test for Lyme. So they're able to pick up even small traces of it very often, when traditional laboratories say you don't have it, where the testing comes out negative. Then there's some labs that are doing DNA testing. They take your blood and they look for the DNA from these co-infections. And then there are some labs that are culturing your blood to see if some of these infections show up. Not do all the different testing if you need testing, okay? Since insurance doesn't accept what we do because we practice out of the standard of care, when you practice out of the standard of care, you can't bill an insurance company legally. Technically, you're robbing them. I know it sounds crazy, but technically you're robbing them. So you're not allowed to bill them, and therefore it doesn't really matter. So, but with testing, you cannot prove definitively that you don't have it just because the test was negative. So that's clear. And many people go into remission. right after they get that initial infection. Now, they may go into that stage 1. When they go into stage 2, they start to have symptoms later on, but these may come and go. So because these symptoms come and go, they think they caught a flu again, or maybe something else. Maybe they got arthritis or many other things. In fact, when you get to stage 3, that's called neurologic Lyme when you're in stage 3. And I've had the majority of patients that we've seen have come in that way. And now they're deep in Lyme disease. And I'm going to go over all the symptoms in a minute, and then we're going to talk about how do you fix it. So in any case, when they, over the course of stage 2, have periods of time where they're feeling very ill, and they're feeling so ill, but they don't look terrible. You know, when people get sick, they look horrible, but you don't necessarily look horrible. And then there's remission. Then it comes back again because these organisms go through life cycles. So many people are being treated inappropriately by psychiatrists because their family members believe they're crazy. And they have sent them to a psychiatrist because nobody can find anything wrong with them. So they think maybe they're malingering, or they have Munchausen, or they have various things other than, but they're insane. You know, that there's nothing wrong with them because nothing can be found, yet they complain seriously about all these different symptoms. Stage 3 is more definitive. Now, one of the problems that I'm faced with is when people come in stage 3, and I go through, they hit certain buttons, and red flags go up, and I take over and I start asking questions. I tell them, well, you know, you've got Lyme disease. Dr. Robbins, I don't have Lyme disease. I've been tested many times. I don't have it, blah, blah. Okay, they get angry at me for labeling them with something that I'm certain they have, but they don't want that label thrown on them. So I have to say when I speak to them, so I'm treating you for the group of symptoms that you have, not for Lyme disease, okay? You can't imagine how upset some of the patients get. Now, the ones that know they have Lyme and come in fine. Now, truly, I've only had 8 patients come in with several thousand Lyme patients now over the last 35 and a half years that I've been doing intravenous ozone therapy as of the date of this show. And the 8 patients came in because they were friends, or they were colleagues, and or they were previous patients for other things, and they knew that ozone could help get rid of it permanently, completely, once and for all, we believe. Now, the reason I say that, we believe, is because initially when I began treating it many 30-something years ago, I thought I got rid of it. And then a couple of patients came back with key but different symptoms. So I said, oh my God, you got Lyme again. Well, I never got bit again. I'm certain of it, blah, blah, blah. Well, then what did it mean? It meant that I put it in remission with, as you're going to learn, intravenous ozone therapy. And I thought I got rid of it, but I really didn't. So over 10 years ago, when I was lecturing in Costa Rica at a medical meeting, I changed my protocol to the one you're going to hear today. And the reason I changed it is because there's no great test to show that it's gone. So as you're going to learn when we go over the whole thing now on how to treat it. So first, let's go into what are the symptoms of this horrible disease. So the way I do it is, and you can almost test yourself now, I ask yes or no questions. Now, if I ask a question like, do you get headaches? And I tell them, you get one headache, even if it's a big one, maybe a month. The answer is still no, because anybody might get one headache even every month for one reason or another. Even if you got a small headache, even once every other week, so it doesn't have to be every day, but even once every other week, your answer should be a yes. So while I'm going through these things, you could be answering and writing down yeses or nos And all you need is enough yeses. You don't need every question answered yes. Do you have this? Do you have that? But if there are enough of them, then definitively I would say I believe you have Lyme disease. Now keep in mind, if you go back to when I first graduated medical school in 1973, you're not going, back then, there weren't a heck of a lot of blood tests available. Today, it's like, wow, they can test for anything, almost anything and everything. But there weren't a lot of blood tests available back then. And the way a doctor worked was you got your medical history by asking your questions, them telling you what's wrong, and you ask questions. Sometimes you might need a physical examination to add on to your information. And then you came up with, if there were a test, of course, you'd run some testing, but then you would come up with what would be called a differential diagnosis. Okay, it could be this, it could be this, it could be this, it could be this. And then based on your clinical impression, you would treat them for what you felt was the top of the list, what you should put on the top of the list. And that's how doctors treated people. And it was based a lot on our clinical experience. You've seen it before enough times to know this is what it is, that it's not something else. Today, if you don't have a blood test to prove something, you don't got it, because they have to be able to get paid and protect themselves legally. All right. Because we work differently, we don't live with that fear and restriction. So now I'm going to go into what I ask a person when they hit the right buttons, and see how many yeses, how many different things you write down. So I go, do you have brain fog? Now, if you have brain fog, you know what brain fog is. Okay, cloudy, brain cloudy, difficulty thinking. Do you have short-term memory issues? Generally, it's not long-term. Focusing issues, staying focused on what's being said or what you're watching or listening to. Do you have cognitive issues? And they often know what I'm talking about, which often says when they say yes, well, then maybe they don't have it. But a cognitive issue means understanding what's being said or coming up with words when you need them. Sinus congestion or sinus problems. A feeling of a tight band around your head. A feeling of a severe or an intense pressure in different places in your head. Remember, these things can come and go. Uh, Ringing in the ears, tinnitus. Uh, Vision disturbances. I don't mean you need glasses, but vision disturbances. You see butterflies, all sorts of weird stuff, or even very serious light sensitivity. Light bothers your eyes tremendously. Okay. Digestive problems. Notice I'm not going specific because they can be many different digestive problems. Do you have a bowel movement every day without exception? That's without exception. That means not, oh, yeah, 363 days a year, but the other 2 days I need dynamite. I don't care if you need dynamite every day to go to the toilet. You should have a bowel movement every day, at least one without exception. Any urination problems? Any problems with your menses? If you happen to be a woman, generally men don't have that issue. Um, Breathing issues, tightness in your chest or difficulty breathing. For no reason at all, rapid heartbeats, okay, coming on and going away with no apparent reason. Depression, anxiety issues, trouble sleeping. Do you have trouble falling asleep, staying asleep? And here's a biggie, fatigue. This is one of the biggest things that come from second and certainly late stage Lyme, fatigue issues, severe fatigue. Doc, I can't get out of bed in the morning. I'm exhausted even after I've slept 10 hours or more. Let's see, what else? Digestive fatigue, depression, anxiety. I'm going through my mental checklist. I know I'm leaving something out. Whenever I leave something out, my mind starts to work, and I don't like to use notes so much when I do these things. Sometimes I do, but I do so much Lyme I don't have to. We have the heart, the lungs, the kidneys. Okay, I'm going to move on, but I'm going to come back to some more symptoms when it hits me what I left out, because I'm certain I've left something out in the group of symptoms. And remember, the symptoms can come and go. They don't have to be there all the time. Oh yes, a skin rash of varying kinds, not the bullseye, which you may have never seen, but a skin rash of various types. It's actually called erythema multiforme, which means it can take on many different forms and it can appear almost anywhere on your body. Neurologic symptoms. I don't know how I could have left that one out. Various burnings, pins and needles, tingling, itching, numb sensation, a muscle weakness, um, not just not and or muscle pain. Okay, differentiating that from joint pain and joint stiffness. Okay, because those are also some of the symptoms. Now I feel I've covered them all. Okay, now very commonly found when people do get testing for this, because the fatigue is a big issue, so doctors almost automatically will test for Epstein-Barr virus, EBV. I've done a whole show on it. Go listen to it. It's very common. It's another, not from the Lyme tick bite, but another infection, viral infection that patients have. Because your immune system is weakened, many of the patients have mold sensitivity, and they've been tested positive for mold problems. Mold is everywhere. I've done a show on it. I'm published on it in a peer-reviewed medical journal on mold and mixed mold mycotoxicosis. For some reason, they don't like to test for other viruses that I think they should: cytomegalovirus, CMV, adenovirus. Those are all herpes viruses as well as herpes 6 that can cause the fatigue issues and many similar issues. And just to throw it into the mix, and I've done shows on it too, candidiasis, overgrowth of a yeast in your gut. Okay, Candida in your gut, overgrowth of it, killing off all the good boys with antibiotics even once in your lifetime. Or if you eat red meat or chicken that isn't organic or farm-raised fish, I don't care if you burn it, you're not going to cook out all the antibiotics that might be in it. And eventually you kill all the good boys in your gut, and that allows yeast to overgrow and causes this. And keep in mind, you don't have to have this or that. You can have this and that, and that and this. So you can have multiple issues causing, all these various symptoms in your body. And this is why it's confusing to doctors. And again, the only thing they can do is give you a short course of antibiotics to try to fight it. And then after a certain point, the antibiotics stop working, and or so they have to switch to different ones, or you're allergic to them, you become allergic to some of them. I mean, it's a very complicated situation when you're dealing with the pharmaceuticals for it. So this is what walks into the office, and I get most of these, not all, but many of them, as positive answers, and therefore I know I'm dealing with Lyme disease. Now, how do I deal with it? Okay, 10 out of 10 patients can have direct intravenous ozone therapy, DIV, and my version of it, RMDIV, Robbins method. I have to say, where in many diseases and conditions it may be a faster fix, when you're dealing with late-stage Lyme, it's a marathon. It is not going to be a 50-yard dash. That doesn't mean you may start to notice benefits early on. Things are starting to be alleviated early on, but it is a marathon. And a lot of the time, we're dealing with Herxheimer reactions, kill-off reactions, where your body can't get rid of the waste fast enough, though we're going to talk about that. And for these patients, I often have to adjust the medicine, sometimes each and every visit. Most of them I don't, but a good percentage of them I do. And the key is to make it more comfortable. This is not about safety. I take Dr. Do No Harm very, very, that's two verys, very, very seriously. But in any case, so we can adjust the medicine, because there's only two reactions we expect you to have from pushing the oxygen and ozone gas directly into your vein. And fortunately, we can use little itty bitty needles. So we're able to get little itty bitty veins because 6 to 7 out of 10 patients don't have big fat veins for the what we call the blood methods of ozone, where we take blood out, ozonate it, and put it back in one method or another. All right. So I'm able to treat 10 out of 10. Plus, the blood methods of ozone you can't do every day, sometimes only once or twice a week or 3 times a week for some of them. And therefore, um, the direct IV method can be done 6 days a week. We always want a day off just to let the body clean out the waste. And it's a fast, easy method. It takes 2 to 6 minutes. If you listen to my show called Intravenous Ozone Therapy, everything you need to know. I go over all about ozone, all the different methods and intravenous methods, and why we use the ones we use in detail. Intravenous Ozone Therapy, everything you need to know here on my YouTube channel. So in any case, we begin the treatments. There's only 2 reactions we want or expect. No reaction at all, you feel better. Many of the patients have strong Herxheimer reactions. If you don't know what a Herx reaction is, go look it up. Okay? It's a Herxheimer or a Herxheimer-Jarisch reaction, and it'll explain it. Basically, to make it simple, your body just can't get rid of the kill-off, the waste that's been created fast enough. So you feel fatigue or you need to go to sleep. Even in a severe Herx, you feel like you're getting flu-like symptoms. In any case, that's the reaction that people have to anything that kills junk in their body. Originally, it was discovered by Jarisch, the Swiss doctor, and Herxheimer, the German doctor, over the use of antibiotics. So it had nothing to do with ozone. It's just about, and like I say, to keep it simple, just your body just can't get rid of the waste fast enough. And so we do things to help prevent that. We're going to go into in a couple of minutes. All right. In any case, so the treatments, the amount of ozone is just medicine. So the amount that I give you can be adjusted. How much we give you, the concentration we use, the speed we push it in at, which arm, which vein. Do you get it every day? Do you get it only 3 times a week, the minimum? It's just medicine. And when you're taking a medicine, particularly for a severe medical problem, normally you would take it every day and usually several times a day. This medicine, the way we use it, the way I've adjusted it and developed it and my protocols, is so wonderful and powerful that even just 3 treatments a week can work. But more would be better. Absolutely. Kill, 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 kill doesn't give anything a chance to regrow, regenerate, and duplicate. And Lyme does that every day. It doesn't care that you wanted to take a day off or you had to go away on a vacation or a trip that you planned. All right, or you have to go to work or school. It doesn't care. And when you get into late stage Lyme, I promise you, you won't be able to do any of those things eventually. I always say, and not in a joking way, there's a 4th stage to Lyme disease. I call it death. According to the Global Lyme Alliance, a wonderful organization that raises money for Lyme research to find a better treatment and a better test, they've worked with me through Tufts University Medical School's research department, won a grant. I didn't get any of the money, but I gave them an ozone machine to use and showed them how to use it. And they treated mice, and we were published. They very nicely made me 4th author of the paper, showing not does ozone work, but how does it work? What is it actually doing biochemically in the body? To work. Very interesting paper, very hard to understand. It was very high level biochemistry to understand it all. In any case, they claim that one person dies worldwide every 13 minutes, I believe, is what they told me. Every 13 minutes from Lyme disease. It's a life-taking disease. So we do intravenous ozone therapy for it. And then Another method, other than the direct IV method that I like to do once a week, is called, if you have big veins, you got to have a big, strong vein for it, is hyperbaric high dose ozone with multipass. Its nickname on the internet is 10 pass. This is where blood comes out, we ozonate it, and we put it back in. About half the blood in your body over a 35 to 55-minute time frame. And it's extremely effective against Lyme. Um, in addition, and you can listen to my show on, and that's discussed in more detail on that Everything You Need to Know About Ozone Therapy show. And then we also can add in, for those that can do it, HOCATT, HOCATT, some pronounce it HOCATT. And in HOCATT, it's a special type. You can see it on the internet. It's an ozone sauna, but it does 8 different therapies at the same time. And with these therapies happening all at the same time, you do it 30 minutes after your direct IV ozone. And when you walk out, most patients with Lyme feel like they had a respite from all the suffering. Okay, they had a respite from all the suffering, and it can last from a few to a few hours, some even a day or more, and they just feel so much like normal again for that period of time. Of course, Lyme is not killed off by it. It's just an improvement and a symptomatic relief, but it's wonderful to get, when you're suffering so severely, to get that respite. And we offer that in the office as well. Now, all the patients have to be very well hydrated for this. You'll hear that on the other shows. They have to take vitamin C 5 or 6 times a day. Now, with Lyme, they can take it 5 or 6 times a day because it can cause those Herx reactions. Yes, vitamin C, whereas in no other condition or disease I've ever seen causes Herxing from vitamin C. But Lyme disease very frequently will. So I don't care how much I care, but I care how often. So even if they take a powdered form of C in a minute dose, just a few 100 milligrams each time, this way the vitamin C is in your body, it lasts a couple of hours, it's used up and gone. And because of the water, the vitamin C, I don't get oxidative stress reactions that some people might be concerned about or worry about. I've not seen an oxidative stress reaction in 35 and a half years and over 430,000 plus treatments that I've done in all the different methods of intravenous ozone, because I came up with that bright idea with water and vitamin C frequently. Lastly, we have to replenish the good boys in the gut, because the gut has 70% of your immune system, and it connects to every organ and every tissue in your body to help it function correctly. I know it sounds strange. Listen to my shows on it and you'll understand better. So we need to put the good biome back in, and that's where Doctor's Biome comes in. As many of you, if you've listened to my other shows, know, I do not sell it in the office, but you can go online to Doctor's Biome, DoctorsBiome.com. Okay. And I always give out, I've been doing it now to everybody who listens to these podcasts. You can use the coupon code Howard35, Howard35, and you get 10% off the retail price if you use Howard35. And if you go on auto ship, you get another, subscribe and save, whatever they call it, you get an additional 10% off in priority shipping, because they run out of it all the time. And you'd want to use it doesn't matter which one, Doctor's Biome Gut Health or Women's Health. It doesn't make, it's the same bacteria, does the same thing. Listen to my shows on it. You'll learn more about it if you're interested. So those are the 3 things you must do for the therapy. Fortunately, if you need to, you can take any pharmaceutical along with it. Antibiotics, if you need to take them, take them. If you're on another pharmaceutical for any other reason, do it. If you are taking nutraceuticals, vitamins, minerals, herbs, homeopathy, Ayurvedic medicine, Chinese medicine, do it. You can do all these things with it because they will not get in the way of each other working. They may work synergistically, but they won't get in the way of each other working. You can be on any diet you want to be on. Now, when you have Lyme, it sometimes helps to have chiropractic because by putting the spine back in alignment, you get the right nerve innervation to all your organ systems. And it's not about back pain, but this is about um, having your whole body work correctly. Acupuncture can be done along with this. You can do any other therapies you want to add on, provided you can afford them. But definitely, they will not get in the way of each other working, no matter what you read on the internet, no matter what anyone else tells you. There is no other clinic in the world that has our clinical experience, the volume and depth of our clinical experience, and certainly not with Lyme disease. I'm certain of that. Um, so you're more than welcome to do all those different things. And I think that's about it. That's what to tell you. This is a long-term therapy to get a person, unless you just got it, over it. And then the sooner you get in to get it, the sooner you can get your life back again, keeping in mind, people wait until it's too late. When it's too late, it's too late. And you don't know until you try. As I always say, better to have tried and failed than never to have tried at all, because then you automatically have failed. I know if you're listening to this show, this is a very serious problem. Now you know everything you need to know about it. And the sooner you get in to start getting well, the better off you are, because as far as I know, there's nothing else out there that's going to work. Everybody, if you have any questions, call my office in Manhattan at 212 581 0101. That's 212 581 0101. And if you want to email me, you're welcome to at Ozone. I do online consultations from patients from around the world. Um, oh, you email me at Ozone Doctor, OZONEDOCTOR, Ozone Doctor, all one word, spelled out, at Yahoo, YAHOO.com. Thank you all for listening. Please stay safe, stay healthy, stay well, and tell all your friends about our podcast. And please subscribe. That would be a wonderful thing. My techies say it's important that you do. I appreciate that. Thank you very much. Bye-bye now.